Hello, my name is Dr. Paul Teich. I am a doctor of family chiropractic. I have sports physician training, rehabilitation doctor training. I'm a fellow of the American Academy of Clinical Acupuncture. I've studied martial arts my entire life. I've studied weightlifting, even have a WNPF trophy or two from a 14-time world weightlifting champion for my work on him, actually specifically in needleless acupuncture and chiropractic. I say all this just to give you a small piece of my background, and I have a great interest in physical fitness, weight loss, and the immune system, which is what all of this is going to focus on. Many people have called me and asked me to put my beginning exercises on YouTube so that they could just watch them. So finally, here is what it is. I would like to affect the body neurologically from the brain and in a simple, no equipment kind of way that everyone can use immediately right now. That also being said, please don't do anything that I tell you unless your doctor has given you permission to do it. So, that being said, here we go. A patient might come in my office, they might sit down on my chiropractic table. And I take a look at them and I see them sit and I go, I see you slouching there. Now, I'm not picking on you, but every time we sit like that, something goes on in the spine called the creep phenomenon, whereby every time we sit, and this is Scott McCormick's spine. He's not using it anymore. He lent it to me. Thanks, Scott. This is a spine. And every time we sit, as I get closer, there I go, forcing an exaggerated sit. Can you see that spine there? In the front is the closed part of a wedge, like that. In the back is an open part of a wedge. And the disc is like a jelly donut. Y'all know what a jelly donut is? Outstanding. Well, the disc, being like a jelly donut, has the soft part in the center and the hard part on the outside. And every time we sit for 20 minutes, the soft part of that disc creeps to the back. In fact, due to anatomy and body positioning, when we MRI people, we find that most of them have posterior and posterolateral disc bulges. A lot of this is because of the way we sit. So I went to the head of Abington Schools and the head of Philadelphia Schools and said, hi, Dr. Paul Teich, your sports physician, rehabilitation specialist, would like to teach your audiences and your kids in your auditorium what they teach in piano class and in California and in China. And they basically said to me, get away from me, kid, you bother me. Well, at this point in my life, I'm a grown-up and adult. I'm not a kid. I was bothering no one. And they were quite incorrect and egocentric for throwing me out. What I was going to try and tell them was that every time we sit, every 20 minutes, cumulatively, the creep phenomenon is going on. And the disc is creeping to the back while we're sitting. Now, to counteract this, we might sit in a different way. Chest out, shoulders back, exaggerated military posture, low back arched. There's a reason they do this to you in the American military, and so they can use your body for more work. Because every time you slouch, the body, being very thrifty, a very use it or lose it kind of thing, where if you do a lot of curls, you get a nice big bicep. If you stop doing curls, y'all don't have a bicep anymore. So, every time we sit and we end up slouching, it literally sends a message up to the cerebellum and the brain that says, atrophy postural muscles. I don't need them anymore. And hundreds of them just get weaker and weaker, and we end up with a very bad posture where our head comes forward and the curves in our spine are abnormal. We normally talk about 3 curves in the spine, but in this short segment, we're not going to. They are necessary, though. You might find my article, My Aim is True, which compares the disappearing curve in 70 to 100% of American people to a bow and arrow for explanation purposes. Every time we sit, we slouch. Our spine curves, it makes a C, it forms open wedges in the back with the vertebrae, closed wedges in the front, forcing the disc to creep backwards, the creep phenomenon. How would we fix this? Well, first, every time we sit, we're slouching, it's sending that message to the cerebellum saying atrophy postural muscles. We end up with this kind of posture. It's terrible, no curve in the neck, anterior neck carriage, that's what we call it when the chin starts going forward, and there's no reason that we have to have this old horrible posture. We should all look like Superman. We should all look like this. And how we do that is if every time we sit, we go chest out, shoulders back, exaggerated military posture, low back arched. And you grab that low back muscle. It took me months to figure out how to fire my low back muscles because I was not at that time used to doing good mornings, a fabulous exercise for that, hyperextensions, reverse hyperextensions, or even squats. I wasn't used to doing them, so I didn't know what it felt like to fire my low back muscles. I wasn't even doing Cobra, a very common yoga move, teaches you to fire your low back muscles if done correctly. Another segment will have the Cobra cycle on it to save your back from pain. So here I am, every time I sit, I go chest out, shoulders back, exaggerated military posture, low back arch. Why do I repeat it? Because it's so simple, yet people can't remember it. Every time I do that, I am using hundreds of postural muscles. I'm sending a message to my cerebellum that says, strengthen postural muscles. I don't want to look prematurely old. I want to be strong and virile until I'm 110. I'll be chasing ladies when I'm 100. I'm 50 right now. Nearly no one my age is anywhere near me physically. People go, Paul, how are you going to do that at 50 years old? I go, well, I don't know any other 50-year-olds that can do 37 upside-down push-ups against the wall. How long does that take you? Oh, I don't know, 10 minutes. Guys my age go, I don't want to do anything for 10 minutes. And what do their wives say? They go, yeah, really, he can't do anything for 10 minutes. Well, it's just a shame, that whole sitting, watching TV, pressing the button thing. If every time we sit, we go chest out, shoulders back, exaggerated military posture, low back arch. And every time we stand, we go chest out, shoulders back, exaggerated military posture, low back arch. And perhaps we even do a lunge. Chest out, shoulders back, exaggerated military posture, low back arch. Switch legs. Chest out, shoulders back, exaggerated military posture, low back arch. You may sit and stand 20 to 60 times a day. Formerly, we were just sitting and slouching. Now, I realize while you're doing your computer work, you can't be sitting chest out, shoulders back, exaggerated military posture, low back arch. You look like a Tyrannosaurus Rex. However, you can set an alarm to do it every 20 minutes. After all, your discs are creeping. You didn't even know it. Every time you sit, every time you stand, it does not count as an exercise. It's a habit for your spine that you need to do every single time you sit, every single time you stand, or keep enjoying getting fatter and your back hurting more and more. Here we are, affecting every cell in our body by using the brilliance of neurology that medical doctors have given us. We know that we can affect the brain to make the body start producing muscle in the area of all the postural muscles. So, there you go for that. That is one of the exercises. 2 is going to be a spinal mobility class. If I was going to tell you, okay, your discs creep backwards because you sit too much, and here you go slouching. So a cure for that might just be bending backwards. But if I only gave you one exercise, then I would further be imbalancing your spine. So I have to give you an exercise for every way the back can bend to affect the disc in every direction possible. Bend backward, bend forward, bend to both sides, twist, and reach. And it would be as simple as this. Bend backwards. Count to 10 deep breaths. Bend forwards. Touch your chin to chest. See if you feel pulling down your spine. If you do, do it more. Count to 10 deep breaths. Bend backward, bend forward, bend to both sides, but in a special way. I am not touching my leg. It makes it too easy. My palm is facing the sky. I'm pulling my pinky back to feel my shoulder blade muscle kick in and reaching at the same time. It's a magic low back pain, hip pain releasing exercise. Count to 10 breaths. Going to go the other side in spinal mobility class. Bending to the side, but in a special way. I'm not touching my side. It makes it too easy. My palm is facing the ceiling. I am pulling my pinky back to feel my shoulder blade muscle kick in and reaching at the same time. These two-directional, pulling back and reaching, very common in yoga, very calorie burning, very pain relieving, extremely puts a lot of blood in muscles. The opposite of our American working out, which is more anaerobic and makes the muscles devoid of oxygen. This type of stretching fills the muscles up with oxygen, especially through capillary beds. Bend backward, bend forward, bend to both sides, but in a special way. I'm going to turn around. You don't have to. Half spinal twist, standing. As I'm doing it, my back arm here is bent, and I'm pulling it back to feel my shoulder blade muscle kick in, which I just felt in a past exercise. Maybe 10 deep breaths. Spinning around slowly, not hurting myself. Please don't hurt yourself while doing this. People tend to do that for insane reasons. Please don't be insane, and please get permission from your medical doctor. Thank you so much. Here I go, spinning around, half spinal twist. I'm turning my spine as hard as I can turn my spine. I'm turning my neck as hard as I can turn my neck. I'm not breaking myself, and my back hand is bent, and I'm pulling it backwards to feel my shoulder blade muscle kick in one more time. As I'm doing these, I'm also balancing, which gives me some PNF, or proprioceptive neurologic facilitatory benefit, or when you do exercises that force you to balance, there is a side effect that causes decreased pain in all joints of the body. So we are affecting you in that way too. We bend backward, bend forward, bend to both sides, twisted. The last one is reach. I'm going to reach as high as I can. 3 1,000, 2 1,000, 1. I'm going to reach up higher. Want to feel it in my armpit. Want to feel it in my ribs. Want to feel it in my low back. It is decompressing my discs. I could teach you to stand on your head, but I can't do that on a video because somebody will fall and kill themselves. So please don't do that unless you're with a qualified expert. I'm going to switch hands. I'm going to reach up as high as I can. 3 1,000, 2 1,000, 1. Reach up higher. 3 1,000, 2 1,000, 1. This is the hardest one. Feels like a sack of potatoes on your hands. Reach up higher. 3 1,000, 2 1,000, 1. Causing a myofascial release. I invite you to look that up throughout your whole entire back. Low back, upper back, mid back, low back, neck, shoulder. Fabulous. That's spinal mobility class for the purpose of using the creep phenomenon, which has been working against you your entire life while you've been sitting as an American in a chair, slouching. You know, at least in Catholic school, you're in a hard chair and they're telling you, sit up straight. Well, I mean, they were right the whole time. We have talked about posture class, which is every time you sit and stand. Chest out, shoulders back, exaggerated military posture, low back arch, ends up making you look like Captain America. 2 was our spinal mobility class, which is bend backward, bend forward, bend to both sides, twist and reach. And the third exercise that everyone gets when they come in is swimmers. As we said, 70 to 100% of Americans lose the curve in their neck. There's a long explanation for that, not for a little YouTube video. We would certainly want to affect all the curves in someone's back and as much postural muscles as we possibly can, even so that people could hold our adjustments better as chiropractors. So the third is called swimming. I didn't mention, I also am a water safety instructor, teach swimming, and I'm a responder for the Red Cross and teach CPR, very important for everyone to learn that in every job. This is called swimmers. And here I go, I'm laying down, and I'm raising, opposite arm, opposite leg. I'm also pushing myself up here. I'm trying to touch the back of my hand to the bottom of my foot, and the back of my head to the bottom of my foot. I am arching my neck back as far as I can. If you can't ever touch the back of your hand to the bottom of your foot, you'll probably never have back pain again. My head is all the way back. Why? I am working on the lordotic curve in my neck because I want it to be strong. I'm going to switch. Opposite arm, opposite leg. Trying to touch the back of my hand to the bottom of my foot and the back of my head to the bottom of my foot. I am working on some low back muscles that are supposed to be the bottom of my kinetic chain and the strongest muscles in my body, and they're usually the weakest in everyone. People can't even lift their leg. They get a cramp in their hamstring. They get a cramp in their low back. They get a cramp in their glute. They can't even do it. When you're doing these, 1 1,000, 2 1,000, 3, and switch, I'm swimming. 1 1,000, 2 1,000, 3, switch, I'm swimming. 1 1,000, 2 1,000, 3. It's so hard to do that you might as well stop after 1, 1,000, 2, 1,000, 3, 1,000 and switch, because your performance deteriorates. So you might as well switch so you can have maximum performance and be getting maximum muscle building. You're also working on the muscles for your low back curve and your neck curve while you're doing it. You're pushing yourself up, similar to push-up. Many girls, women over 37, can't do it at all. No one needs to be that weak. These are the 3 beginning exercises for everyone who comes into my clinic. Posture class, spinal mobility class, and swimmers. That's the first 3. God bless you. Have a great day.